My name is Alice. I'm a social worker from the Richmond Mental Health Social Care team, and I've been in the job for about a year after qualifying as a social worker last year. So as a social worker in the mental health team, I do social care assessments. So that's about kind of assessing people's social care needs, whether that's that they're able to get out in the community or take care of their personal care needs and feed themselves adequately. So all of those kind of needs, as well as doing safeguarding. So working with people who might be at risk of abuse or neglect, working to try and keep them safe. The best part of my job, I'd say, is kind of how varied it is. So working with lots of different people each week is really good. So far I've found that kind of no two cases feel the same. People are very different in terms of the kind of support that they want and kind of how they want to go about accessing support services. So in terms of the difference that my job makes to individuals' lives, I think one of the main things for me is working in mental health. The client group is quite socially isolated often, so lots of the people we work with don't have much social contact at all. So a large part of my role, as I see it, is kind of helping to get people connected to their community, whether that's attending local groups or meeting up with people, using local resources like Mind, that kind of thing. For me, I'd say the most challenging part of my job is kind of the fact that as a social worker you often intervene at a point where a person's in crisis. So it's a really stressful point in their lives, and if you intervene very late in a situation, it can be more difficult to resolve it, both for the person and for the social worker trying to support them.